Welcome to the New Dentist Study Club podcast. My name is Dr. Sanj Mohanta. We're going to learn about clinical management, practice management, and the emotional management of dentistry. Let's learn how to be happier in dentistry. Let's go. Welcome to the New Dentist Study Club podcast. I have Michal Er, who's a social worker, and she's joining us to give us some tips on the emotional management of dentistry. So, Michal, welcome to the podcast.
Thank you, Sanj. I'm happy to be here. I'm equally nervous and excited. This is my first podcast, so we'll see how it goes.
We are honored to have you, and we're excited. So, Michal, you're a social worker. How did you get into that?
I was a special ed teacher, actually, as my first career for many years. And then I felt like I wanted to try and make a bigger impact beyond the classroom. So I went back to school. I got my master's in social work, and I work part-time at a community-based organization and part-time in my private practice, supporting mostly people in their 20s and 30s who deal with anxiety, depression, stress, and other issues.
So you're perfect for this podcast where we're talking about how to manage our emotions in dentistry. Because when I was a new dentist, even now as an experienced dentist, I got so stressed out because in dentistry, nothing's ever perfect. And in school, I was used to being close to the top of the class. I was used to, getting that 100%. And then in dentistry, I would lose sleep over something as small as, oh, the crown didn't fit and I have to bring the patient back. So, Michal, how can you help us here?
First, let me state that I am providing general advice. It may not be applicable for any individual situation, any individual dentist. So please, if you're dealing with emotional distress of any kind, please get some support. And about this specific situation you're describing, I want to say, first of all, it's hard. It's hard to be feeling like I have to bring someone in. I have to repeat a procedure that I'm supposed to be competent in already. And what a change from when you felt so in your element, getting A's, acing everything, and then real life presents itself. And guess what? It's not perfect. And you're not perfect. I know that may be a shock to some of you dentists. And I feel like you're talking about difficulty with failure. And I feel like we need to also deconstruct a bit the notion of failure. Failure has become a bad word. Like, no one wants to be weak. No one wants to be a victim. People use those words with disdain. Being a victim, for instance, just means that someone hurt you. And even if you chose to be in a relationship with that person, you didn't choose to get hurt. So I think we also need to look at failure as what it actually is. It's not inherently bad. Failure is just an undesirable outcome. Of course, we feel disappointed. We wanted the other outcome. We expected the other outcome, and that's not what happened. At the end of the day, though, it is just it. It's a different outcome than you expected. So try to get more comfortable with the idea that things are not going to always work out, and it doesn't mean you're bad. It just means that something went wrong. Use failure as a learning opportunity rather than an indictment of yourself.
I like that. We shouldn't even use the term failure. Instead, we should say, okay, the procedure didn't go well. I'll do better next time. We have another chance here. That positive self-talk is so important.
Yeah, but notice also that it's not just what we now call toxic positivity. It's not just count your blessings, look at the bright side. It is first of all acknowledging that this is hard, that this is disappointing, that this
Yes.
is destabilizing you.
Yeah. Now, there's also imposter syndrome. And I spoke with a lot of new dentists, even one of my friends who's been practicing over 20 years, and they said, I feel like I should be better. I feel bad for the patient because I know there are better dentists out there. I see them on Instagram, and maybe I shouldn't even go into work because I'm not the best dentist for them. What do you say about that?
Yeah. I feel like this is another social construct here.
Yes.
And if perhaps this is what you get when you invite a social worker to a podcast. Um, I feel like our society uses competition and comparison as maybe the only motivators. And to top that, younger people, you're still, some of you are still sort of exiting your teen years in a way. You're so used to looking at your peers to compare and contrast. I think these are very useful tools for evaluation, but they're not complete and they can be harmful. There's a few pieces here. One is, let's look at the actual evidence. If you couldn't do this job, if you were not qualified, you would have not graduated.
Hmm.
Someone looked at you performing procedures. It's not just a theoretical class. You've gone through a lot. You are qualified. So that's actual evidence. It's different to what you're feeling inside. And that's where the self-judgment comes in. I suggest we think about comparison as perhaps one tool and not feel like it's all encompassing and it's completely accurate. Because what stains this tool is what you see on social media, unrealistic expectations.
Mhm.
What also gets evaluated is one other thing I want to ask. Is it just which procedures I'm doing at which point in my professional life, or is it the quality of the care, the connection with staff, with the patient? We don't all learn and progress in the same at the same pace. We have different learning styles, different learning needs. Some of us have a lot on our plate. Can't remember who said that, but there's something about not trying to, you can't win the race because you and that person you're comparing yourself to are on two different courses.
Yeah.
You're on two different paths. There's no way to win this race. And maybe stop using, try, it takes work, stop using comparison and competition as a tool for self-judgment.
Hmm. Just think about getting better yourself. And like you said, that the clinical procedure isn't just about the filling. It's about your total care, your communication, your empathy. So maybe the filling wasn't perfect, but the patient still had still received quality care because of all those other aspects of the dental procedure, the patient experience.
And keep in mind also that patients have choices. If
Yes,
they're unhappy with you, they will not come back.
exactly. Yeah, that's true. So thank you. And I told you about one of the things that stresses me out is time. We have to finish procedures on a certain time. It stresses me out when I'm running behind schedule. The staff's upset, patients are upset. And you said something to me like, hey, you're not dental 911. You don't have to fit everyone into your schedule that day. So can you Tell us more about that.
Yeah, you're not an emergency service. That's really important for you guys. Most of you, I'm guessing, are not.
Yes.
There are some dentists who are. And even then, they have hours. They don't, one dentist cannot fulfill the entire need of an entire community. I would say wherever possible, it's not always possible, but wherever possible, set more realistic time frames. Or if you're not your own boss, advocate for more realistic time
Yes.
frames. And see if that helps reduce the stress and increase the quality of care. Who wants to see a stressed out dentist?
Exactly.
And who wants to be a stressed out dentist that is more prone to making mistakes? I can tell you in my private practice, I used to see people for a 50-minute session, and then I had 10 minutes between the people. In that 10 minutes, I had to maybe complete my notes. I had to get a drink of water, maybe use the washroom, read the notes for the next
Hmm.
client. It was so stressful. And since the pandemic, I've realized I don't have to work like this. I see perhaps less people. I
Hmm.
now give, I provide 60-minute sessions because I feel like it's less rushed. And then I give myself about 3 times the amount that I had before for a break.
That's fantastic. I love how you said to advocate for more time because many new dentists are associates. They're not practice owners. They feel like they have to abide by the schedule given to them, but then they get stressed out, the assistant gets stressed out, and just ask for more time. And that's what happened to me. It was actually my assistant who asked for more time. And then it was like, oh, thank goodness you did that because now we can provide better quality care. So everyone's happier, especially the patients.
And yes, and I would say use that additional breakdown to have a moment with yourself to check in, see what you need. Maybe you've had a really difficult procedure. Maybe you had a really difficult patient. That happens sometimes.
Yes.
Just take a minute, you know, unwind, center yourself, see what you need, get what you need if possible, and then move on to the next person from a more grounded and peaceful place.
Yes, I like how you said that you have to like process what just happened with your last patient. Otherwise, you're going to bring all that stress in with you to your next patient.
Yeah.
Now, Mikhail, how about we're in the middle of doing a procedure and something bad happens? Like we're extracting a tooth and the tooth breaks and things aren't going well. What advice do you have? Like what should we say and do at that moment?
I think that really depends on your level of comfort with what you're doing and your level of comfort with being transparent about how you're feeling about it. So if you've noticed, and I did that really very mindfully when we started talking, I
Yeah.
disclosed that I was feeling nervous.
Yeah.
I do that for 2 reasons. Um, First of all, I want to tell my brain what's going on. Whenever we give our brain a, a headline, I'm feeling sad, I'm feeling joy, I'm feeling stressed, the brain doesn't have to wonder what's going on, what kind of distress this is. So already there's a bit of a relief. And the other piece of this is I don't have to pretend now that I'm not nervous.
Yeah.
I already made it clear to everyone, to you, everyone watching this, I'm nervous. Guess what? I'm human. And then I don't have to spend any energy on pretending to be or to feel something I'm not. So you have professional ways of doing things. I'm not saying start crying in a dentist room and in your clinic and start having a very dramatic moment because that's going to freak out the patient as
Yes.
well. but you know, clinically, you know what to do. So just take a moment and explain what is happening. This was not expected. I didn't think this would happen. Sometimes this happens, and this is what we're going to do about it. And this is how long it would take. I think for us and for you guys and for your patients, I find it really helpful as a patient when the dentist tells me, all right, one more, injection here, or
Mhm.
5 more minutes in the session, or we're almost done. So as transparent as you can be, even saying, oh, I'm sorry, Mr. or Ms. whatever,
Mhm.
your or I'm sorry, Johnny, your tooth broke as we were extracting it. This sometimes happen. We have a protocol for that. It's disappointing. It's not what we wanted to happen right now. It means you're going to be in the chair just a while longer, just, and then later with yourself, with your assistant, with your mentor,
Mhm.
have a conversation about could this have been prevented or avoided? Just try not to freak out. Things happen.
That's great. I love that advice. Like, instead of just digging at that tooth, like, put your instruments down, take a break, ask the patient how they're doing, explain what the situation is, give them options, and do the right thing. And I like afterwards you can assess, um, analyze whether you should have even done the procedure, how you could have done the procedure better. But at that moment, just take care of the patient and take care of you as well.
Yeah, this is a really important piece to keep in mind also. If you're not okay, your patient's not going to be okay.
Yeah.
So take care of you first. It's like that,
The
that
oxygen bag
that
mask in on
oxy.
the airplane.
Yeah.
Yes.
First put it on yourself, get your composure, and then explain to them what's going on. Because remember, as freaked out as you are, they are more vulnerable. They're lying down there. It's a very vulnerable position. Once you have your composure back, let them know what's going on.
Excellent. Now, Mikhail, you're a therapist. Should everyone get therapy?
No,
Okay.
some people have developed their own strategies, tools, um, gotten great insight about what motivates them and what hinders their progress emotionally and otherwise. Some people have very caring and available friends and family members. I don't think everybody at every moment needs therapy. However, when you're graduating, you're starting a new profession, you've now maybe worked in it a few years, maybe you're dreading going to work because stuff is
Mm,
happening, which is really, really tough. Uh, it is good time to take a look at what's going on for you. I would say a lot of people come to me and say, my friends and family are just exhausted listening to me. I think that's a good indication. It's time to go to speak with someone who is trained in a very specific way of listening. Um, that's not just going to give you advice, but actually going to look deeper with you and see what patterns need to change. The other indication is if things have been really hard or have been hard for a long time or both, that's a good time to go see someone.
mm. And for example, you're not sleeping well.
You're not sleeping well, you're using distractions like many hours of scrolling on your phone, mindless scrolling, you're using food, you're using alcohol or something else to numb what is really
Yes.
going on for you. Absolutely.
Okay. Thank you. And Mikhail, how about you? When you were stressed, what do you do?
Um, I first thing, and this is something I learned really recently, I actually try to breathe out because I've just heard when we breathe in, when we
Mhm.
do this, the mind body thinks that there's something threatening happening,
Yeah, it even sounds like you're scared when you do
right?
that.
Right?
Yeah.
You're like, so
Yeah.
I try to breathe out now, first of all.
I love that
Of
tip.
course, then I'll breathe in, but I'll try to breathe out first. I'll try to check in with myself. I think stress is not bad. Let's just say that.
Mhm.
Stress is an important part of life. It helps us meet deadlines. It helps us have difficult conversations when they need to happen. And it becomes troublesome when there's no relief from it, right? You know, you cram for a test and then you know there's going to be relief, there's going to be downtime. If we don't get that downtime, that's when prolonged stress can become harmful.
Hmm.
And so I try to see what's going on for me. Is this just um, a very busy time of year?
Mhm.
I don't know if it is like that for dentists, end of year, people
Yeah.
using their benefits.
Exactly. Yeah.
Then even then you can set your own boundaries. You do not have to take every person that just realized that they have some benefits left. Um, that's the first thing. I then try to go into my self-care activities. I try to also bring some reality in. Is this urgent or important?
Hmm.
Personally, I like finishing all my tasks for one job Thursday at the end of the day. That is not always possible. So I try to get comfortable with the fact that that's not always going to happen. And the other thing about stress, this is like everything else. We need maintenance. We need to work out. We need to sleep well. We need to drink water and tea. We need to do yoga. We need to go for a walk. Whatever helps you, we need to meet friends. We need to pet our pet. We need to listen to music. We need to watch funny videos. Whatever replenishes us.
I love that. And you know what? I do the exact same things to relieve stress. The walks, the breathing, talking to your friends, yoga, exercise, making sure I eat well, sleep well. Like there are basic things that we hear all the time, but they work.
Yeah.
And we have to schedule it in or else it's not going to be done.
And a word of caution to the dentists who are perfectionists. If one day you're not working out or a whole week you're not working out, that's okay. You're not failing. It's just not
Good.
available to you right now.
Yeah. Don't
We
be so hard on
do
yourself.
we do what we can in the moment.
Yeah, because it stresses you out that you didn't get to your self-care. Thanks for pointing that out. Now, Mikhail, how can people get a hold of you? And do you have any resources that we can use to help us with our emotional management?
Yeah, I think first of all, if you want to reach out to me, um, I do a bit of a phone consult to make sure that I'm the right person to support whoever is coming to me. And sometimes I just refer elsewhere if I don't think I have what that person needs, or if I'm full. Best way to reach me is through my website www.michalerl.com. And in terms of resources, first of all, let's talk about the first aid things.
Mm.
If you're in high distress, please call the Distress Center of Toronto. If you're not in Toronto, there are distress centers elsewhere. Um, Also, Talk Suicide Canada is a really important resource. I know the myth about dentists having a higher rate of suicide has been debunked. And you guys are still in a really stressful occupation as healthcare providers. So Talk Suicide Canada, you can call or text 998. Really, really simple. There's also a free skill building program called Bounce Back Ontario. This is to help people deal with mild symptoms of depression and anxiety. You can just Google Bounce Back Ontario. You can self-refer. Your doctor can do that too, but you can also self-refer. I also think if you don't have a family doctor, that's a challenge, but please try and find one, because they could be the first person you go to if things really, really go badly for you. And to find the therapists, you go to psychologytoday.com. It doesn't have only psychologists. It has registered psychotherapists, social workers, anyone who's qualified to provide psychotherapy in the province of Ontario and beyond. I think it's a national, an international resource. Online, I'm just going to mention one person who I think is wonderful. Her name is Tara Brack, and you can find her on YouTube. If you don't know her, she does a lot of work around self-compassion, which I feel is sort of the antidote to the perfectionism and the self-judgment. And finally, I'll mention one book that I think is amazing by Linda Graham, MFT. She's a very, very experienced therapist from the US, and she's written 2 books. I'm just going to mention one now. It's called Resilience: Powerful Practices for Bouncing Back from Disappointment, Difficulty, and even Disaster. It's a 2018 book. I think it's very, very useful. She also had a website you can check out. I'm not sure if it's still up because she's retiring, but you can check her out as well online, Linda Graham, MFT.
Thank you, Michal. And thank you for mentioning all those resources. I also love Tara Brach. I'm going to check out that book, Resilience. And thank you for mentioning Psychology Today, because that's where people can also find you. It's a great website. So thank you, Michal. You did a fantastic job on your first podcast.
Thank you.
I learned a lot. I'm going to drink some water, enjoy the sunshine, go for a walk, and I hope all our listeners practice some self-care today and some self-compassion. And I hope that the next time you go to work, you'll be a little bit happier. So thank you, Michal.
Thank you.
Thank you for listening to the New Dentist Study Club podcast. Listen to us on Spotify, watch us on YouTube, share and subscribe, and follow us on Instagram @New Dentist Study Club.